Hello and welcome to the Multiple Sclerosis Association of America's live webinar, The Partnership of Care, Redefining Caregiver to Care Partner. My name is Peter Demiri. I am the Vice President of Programs and Services for MSAA and your host for tonight's program. Tonight's webinar is part of MSAA's 2019 MS Awareness Month campaign on MS and the family, spotlighting care partner needs. I would like to begin by thanking EMD Serono for supporting this Care Partner initiative, which includes this webinar, an upcoming Ask Me Anything online program, an audio podcast, and in-person educational programs. As you may know, MSAA is a national nonprofit organization dedicated to improving lives today for the MS community. Listed here are just a few of our many free programs and services provided across the country. I encourage you to visit our website or give us a call to learn more about our programs and ways we can help you better manage your MS. And lastly, tonight's webinar will be archived on our website within a few days at mymsaa.org. As you're watching the program tonight, we encourage you to ask questions about the presentation by typing them into the chat box on your screen. We'll have a question and answer session at the end of the program and try to fit in as many questions as time will allow. If you have any technical issues with the webinar, please type your concern into the chat box and a moderator will reply to you. At this time, I am very honored to introduce our guest presenter, Megan Weigel. Megan is a nurse practitioner specializing in neurological care in Jacksonville Beach, Florida, where she brings a unique integrative medicine and holistic nurse perspective to her practice, First Coast Integrative Medicine. She is the past president of the International Organization of MS Nurses and is also a board-certified advanced practice holistic nurse. Megan, thank you so much for being here with us tonight, and welcome to the program.
Thanks, Peter. It's great to be here, and I really appreciated being asked to compose this conversation that we'll have together tonight about the partnership of care. Tonight we're going to talk about the concept of a care partnership between a person who lives with MS and his or her support team. We are going to list the roles and responsibilities of the person living with MS and the care partner in that partnership to make sure that it's a successful one. We'll talk about the importance of self-care for the care partner and the importance of communication between the care team and the person living with MS. And then I hopefully will provide you with some useful resources and tools as you move through this life with MS in your family and in your friendships and in your work relationships so that it can be a fruitful one for you. So we've finally been able to really document that about 1 million people in the U.S. have multiple sclerosis, and many of you may be familiar with the old statistic of approximately 400,000, which we knew was very shy of the truth. And if you think about the fact that the average size of a household in the U.S. is about 2.5 people and some dogs and cats, MS affects way more than 1 million people in this country. In fact, I would argue that it goes way beyond a household. So I know, of course, I'm a nurse practitioner and I care for people who live with multiple sclerosis, but in the process of being around this disease state for almost 20 years, I now have many dear friends who have multiple sclerosis, not just because I met them in my practice or in my yoga work with people living with MS, but just because that's the way the cookie crumbles. And as a friend, I consider myself a support partner or care partner. So MS affects 3 to 4 women for every 1 man. And guess who are usually care partners traditionally or support partners? For most conditions are women. Women are usually the ones that take on that role. So in this case, we have more male care partners. Most people with MS have the relapsing type, and fatigue, emotional, and cognitive issues are often the reasons that people with MS leave the workforce rather than physical issues. MS is unpredictable, and so we don't know that, a person who's sitting in front of the computer tonight who has no visible or invisible symptoms of MS will be that way in a year. We don't know if the person who's in an acute relapse will completely recover or not. Your MS does not look like your friends. It does not look like your sisters or brothers, and it may never look that way. So all of this causes a lot of worry and anxiety, just the unpredictability of everything. And even years of stability don't take away that nagging worry for so many people. One of my best friends who I teach yoga with to people who live with MS does not have any visible symptoms of multiple sclerosis, but she still goes to bed every night with the same worry of what might happen tomorrow. So it really takes a village to care for a person living with this disease, no matter how they look, no matter how they feel, no matter how they don't feel, no matter how many specialists they see or don't see. So you have a person who lives with multiple sclerosis, and then you have friends, family, neighbors, and these may be people that you see in person, or in today's day and age, these may be your virtual community. Many of the people that I care for don't necessarily have a large physical social community, but they have a very large presence and a very large emotional and social support system from the internet, either from blogs or Facebook groups. So a virtual community can also be a big source of support. And then you have healthcare providers, physicians, nurse practitioners, PAs, nurses, your rehabilitation specialists, psychologists or counselors, exercise specialists, nutritionists or dietitians. And then if a person does need more hands-on care, you may have housekeepers, home health aides, people who help with transportation, and even community resources for respite care. So the village can get bigger with time. I would argue that you should have a really big village. You should have access to it. You should know who's in your village. You should know where and how to find those people, because when you need them, you need them. When you need them, it's too late to go finding who they might be. So sometimes people who live with chronic illnesses really want to minimize the effect or what they would consider to be the burden of their chronic illness. And I would argue that it's smart, it's effective, and it takes anxiety away to know who your village is before you need to call on them. Management of MS is complex. So if you have a relapsing form of MS, you would most usually be on a disease-modifying therapy. And these therapies decrease the relapse rate, they slow down disability progression, and they decrease the rate of MRI change. For primary progressive, we have one FDA-approved therapy that slows down disability progression. But then you get to this period of time where you may be facing the possibility of a secondary progressive diagnosis, and you think, well, what does that mean for me? Do I have secondary progressive MS? Is it just because I've had the disease for so long, or have I been getting worse over time, or have I stabilized? When, if ever, can I stop my disease-modifying therapy? How will I know? So you really, as you get older with multiple sclerosis, you face a lot of unknown questions. And then you have symptom management, which we use medications for. We use rehabilitative therapies like PT and occupational therapy for. We use integrative medical therapies for symptom management like acupuncture, massage, Reiki, meditation. And then if you are still having relapses, then we have relapse management. So you have a relapse plan, which means you know whether or not certain treatments for relapse management like steroids or ACTH work for you, and you have a toolbox. So you know what happens if you have a symptom suggestive of relapse. You know who to call. And really, even though you don't have to think about all of these forms of management all the time, you know, there is that little wheel in the back of your head. It's a complex situation. There's lots of information. Worries are different sometimes, and I think that this is the first slide that really speaks to the importance of communication between a person who lives with MS and a care partner, because often that person who's living with MS feels like they don't have the same concerns as the care partner. They don't want to bother the care partner. They don't want to burden them. And they're thinking that the care partner is worried about, say, actually caring for the physical needs of the person with MS and not necessarily considering their emotional needs. So these are the things that I hear the most. A person who lives with MS says, what if I become disabled and can't work? And the care partner doesn't see that as a burden. Rather, they say, how will I support our family if he or she can't work? And the person with MS says, if my MRI changes, what does that mean? And the care partner says, what if my partner comes home from the MS doctor upset? You know, not necessarily focusing on the nuances of the disease, but just how can I take care of this person in the moment? Person with MS may say, well, I run out of treatment options. You know, you've in your head created a situation that's decades down the road. And then the care partner saying, how do I know if her treatment or his treatment is really helping? So in a lot of ways, you have the same worries. They're just voiced differently. And that's why, again, I think this is the first slide that speaks to the importance of communication. So let's talk a little bit about why we are speaking in such specific terms tonight, specifically caregiver to care partner. So a caregiver is someone who provides hands-on assistance with activities of daily living like dressing, bathing, toileting, transferring, and feeding. This is, let's say, a caregiver. Traditionally these days we're thinking of someone who is more hands-on, providing assistance with activities of daily living, perhaps more task-oriented. Peter and I were having a brief chat before we started the webinar, and we were talking about other areas of healthcare where people use support. And the one that I can think of that I also deal with a lot in my practice is dementia. And I don't think there's as much of a push in dementia to call the caregiver something different. What we're doing with language and moving to a care partnership is really respecting the whole being of the person who lives with MS and considering, just like we do in medicine in the MS visit, that shared decision making. Like, we want everyone to be involved. We want there to be a good rapport, an open channel of communication. So in a care partnership, we suggest that a person who lives with MS and his or her support partner communicate well in order to manage the challenges related to MS that happen together, support and care for each other, and then allow each other to thrive. And I think one of the best examples I can give for my own mind, where I really, I almost felt like someone hit me over the head with a frying pan, is I walked into a large room of people living with MS to give a talk, and there was a couple sitting at a table, and the gentleman was in a scooter and the woman was not. And I automatically assumed that the gentleman in the scooter had multiple sclerosis. And so when I asked people to raise their hands and he did not, I thought, oh my gosh, here are these people caring for each other, and they each have their own things, right? We all have our own things going on, whether they're visible or invisible. And so the importance of managing our lives together, managing our situations together, cannot be stressed enough, because we all deserve to be here and to live a happy and fulfilling and hopeful life. And I think that's the most important part of the care partnership, is that you're fostering health, you're fostering wellness, and you're fostering hope in each other. So who's on the other side of the partnership? Well, in most cases, in people living with MS, it's a spouse, a parent, or a sibling, and they occur in that order. 1 in 4 millennials are now caregivers, and I'm using the term caregiver here for caregiving in general, so for all disease states. Families are providing 80% of long-term care in general, so not just for MS, but also for people who live with other conditions and need support and care. Because of the demographics of MS, meaning there are 3 to 4 women to 1 man, care partners are more likely to be husbands, they're more likely to have young families, and they're more likely to be early in their careers, since the disease strikes in that early adulthood most commonly. In MS, the top 3 emotions experienced by care partners are compassion, fear, and anxiety. And so if there are people here on the call tonight who are living with MS, this is a really wonderful, it's just a really wonderful nugget to tuck away when you feel like you are burdening your loved one, when you feel like you are too much, when you feel like you just don't need to put pressure on someone, the top emotion that your support partner, your care partner is experiencing is compassion. And then the other 2 are just a direct result, I think, of wanting to do the best job possible. The top 3 negative impacts of caregiving on care partners are on finances, obviously because perhaps the person living with MS has left the workforce, or because the care partner has to cut down on their hours. Also hobbies, not having time for interests anymore, and then mental health issues. The top 3 positive impacts on relationships with the care our relationships with the care recipient, children, and other family members. And basically what that means is that if you're doing a good job communicating in a care partnership, then you actually are going to have a more fulfilling family life. Care partners in MS. So let's talk about women who are care partners first. Women typically report increased levels of burden or stress. They report increased medication use for stress, anxiety, and sleep, and they report more health concerns. And I think women in general have a tendency to just be a little bit more vocal about, let's say, their emotional needs. Men who are care partners, on the other hand, report more physical concerns. They are less likely to tell their PCP, or primary care provider, about their role as a care partner. And in spite of this, they actually are the ones who have the greater health risks. Children are just not equipped to handle the primary care partner role. Even older teens and young adults really should be allowed to focus on their blossoming young life rather than being a primary support person, if at all possible. On average, care partners in MS spend about 24 hours per week in the role. They're about 52 years old. They miss about 18 days of work per year, and greater than 40% will miss work in a given year to participate in care partnership roles. They will change jobs at a rate of about 10% because of needing more flexibility. And they perceive more burden with primary and secondary progressive courses of MS, and that's very likely because there's typically more disability associated with these two types of multiple sclerosis. So the most stressful symptoms requiring care are fatigue, mobility, bladder issues, depression, and cognitive changes. And I'd like to just settle for a minute on this picture and tell you a story about a wonderful family who I have known for at least 10 years. And from the time that I met this woman who very gracefully lived with MS, she was able to move her hands a little bit, and then fast forward 10 years to she basically was only able to move her head a little bit. And her husband, who was her only care partner, fashioned a reclining seat, for lack of a better word, onto her scooter so that he could get her into the office because the wheelchair, the power wheelchair, was too cumbersome, and he couldn't find a place to put her hands correctly. And so I saw them for years, 10 years like this in the office, and I could tell that by the time he got to the office, he was tired. She was usually very calm, but he looked pretty rattled. So I, fast forward until this past fall when I finally said, I don't know what took me so long, but would it be easier for you if I came and saw you in your home? Because my practice will now allow me to do that. And they said yes. So I went to see them in their home, and I was blown away by the effort that he went through to get her out of her room, into the transport chair, into the van. And I thought, my God, how stressful that his role was on him. But when I got into their home and he showed me, very proudly all of the systems that he had in place for taking care of her and for turning her and for helping her sit up. I mean, he had a system that would have put any nursing professor to shame. Really, when new home health nurses came in, he probably gave them the best education that they ever had. But I know that the mobility issue for him was a difficult one, and one of the ones that was most stressful. So taking that out of the equation for him was helpful. Fatigue can be stressful because it's hard to see, and so that again is that communication of a person saying, I just can't go on. And then the care partner saying, but you look okay, but you look so good. What do you mean you can't go on? You did fine yesterday. Bladder issues can be stressful because they're embarrassing. They result in feelings of uncleanliness. They change a relationship that is oftentimes an intimate relationship into one that's more of a medical one. And then you then you try to go back and forth, and that's hard, especially if you're not communicating. And then depression and cognitive changes are difficult because they can fluctuate and they're hard to keep up with in a household. I just loved reading this. Whether or not the person needing care had a choice, the majority of people caring for a loved one with MS would say the role made them closer to their loved one. So whether or not you as the person living with MS said, I need a care partner, or get the heck away from me, I know what you think, but I don't need you, but you really needed that person, the person caring for you felt that their role made them closer. Responsibilities of a care partner are best developed together. They very much depend on the condition of the person living with MS. And that by condition, I mean physical condition, cognitive condition, mental health condition. And the responsibilities may vary from day to day. They change with time, so they should be revisited on a regular basis. So, for example, the responsibilities of a care partner during a period of relapse would be much different than during a period where a person may be living with very little disability, or the responsibilities of a care partner during a period of time where a person living with MS has an infection or is having more fatigue than usual, again, would vary. I'm seeing a question pop up about building relationships, and we're only about halfway through our talk, so I promise you we will get to that as we move along here. So these responsibilities actually can only be developed through good communication. So here are some responsibilities of the care person. And again, these responsibilities would vary depending on the type of MS that a person has. But the support may be emotional, and it may be, I don't want to say just emotional, because emotional support is heavy and it can take a lot of energy. The support might be with cleaning, cooking, doing the laundry, or running errands, managing household finances, organizing the family, like who's making the lunches, who's making dinner, who's picking the kids up at school, who's taking them to their after-school activities, who's dealing with where we're going for Christmas, that sort of thing. Bathing and toileting, making appointments or taking a person to an appointment, or keeping track of appointments for someone who may have some issues with memory. Transportation, so taking a person to and from appointments. Health and wellness assessment, meaning like sometimes the person you live with isn't always the best person to do that health and wellness assessment. Sometimes it's your best friend or a family member who might have the ability to be a little bit more raw or more straightforward with you than the person you're living with. So that health and wellness assessment might be done by a larger part of the village. Transferring literally from bed to chair, from bed to toilet, catheter care, wound care, or helping with exercising, like with active or passive movement. So these are all examples of things that a caregiver would need to do. So care partner health is reportedly poorer. Care partners take more medications. They have twice the rate of depression than the general population. Men who are care partners have an increased risk for stroke and heart disease, and they have more hospitalizations in general. And then the chronic stress of caregiving increases the risk for cardiovascular disease, diabetes, and cancer. And mind you, this is not because this is not because you as the person who live with MS are too much or because you're a burden. It's because, in my opinion, intrinsically as human beings, we want to do a good job, and we tend to take care of others before we take care of ourselves. And the analogy of the oxygen mask is so cliche, but it is so poignant and important. As a care partner, you have to put on your own oxygen mask before you can help someone else. The same thing holds true in my world right now as a new mom. If I'm not fed, I can't feed my baby, literally, when I was nursing. So it's really important to put on your own oxygen mask first, and this does several things. It gives you a chance to take a deep breath. It gives you a chance to reframe the situation. It gives you a chance to change your attitude, and it gives you a chance to be more grounded and caring in the situation that you're facing. So this brings us to self-care for the caregiver. Caregivers report sleep deprivation, poor eating habits, failure to exercise, not staying in bed when they're sick, postponing or not making needed appointments for themselves. And this little graphic here, it actually reminded me a lot of what the way we describe fatigue related to MS. But it also is a pretty good graphic for describing a worn out caregiver whose battery is on empty, who's unplugged, and who really needs some resources for self-care. Burnout happens because of major role changes in the relationship and no one is talking about it. It happens when you sacrifice your physical and emotional needs, and this leads you to feel guilty if you feel angry or isolated, and then guilty if you choose to do something for yourself. So whether or not you're doing something for yourself, you're feeling guilty. And that's really not a great place to be in. It doesn't serve anybody. It doesn't serve you, and it doesn't serve the person for whom you're trying to care. Invisible symptoms of MS, like cognitive issues, fatigue, and emotional issues, can be more challenging than physical ones for care partners because you can't just fix them. You can't transfer a person. You can't turn a person or prop a person up and make them more comfortable. You can't give them a medication and make them more comfortable. You can't, get them to the bathroom and make them more comfortable. Even if you help them remember something, they still might feel bad about not having the memory that they used to. So additionally, these symptoms are invisible. And so maybe the person feels unvalidated or trapped by the symptoms because no one else can understand what they're going through because everything looks all hunky-dory, right? And it's really not. It's really quite difficult. So burnout happens when these things are high on the list, hot on the list, and needs aren't being met. Warning signs of burnout for a care partner are getting sick frequently, feeling always exhausted, having mood swings, noticing behavior changes or brain fog, and then building anger or frustration. So, if your response to the person for whom you care is always just a quick a turt response or a curt response, instead of really taking time out to have a thoughtful response. And then warning signs of depression can be similar. So changes in sleep pattern, changes in interest or activity, feelings of guilt or increased worry, changes in energy level, either too much or too little, changes in concentration, appetite, too much or too little, psychomotor disturbances are things like always feeling clumsy and klutzy and dropping things, and then suicidal ideation, or just morbid thoughts, thinking about death. And, mental illness is a huge problem for people living with MS. It's a much more significant and prevalent problem than we believed it to be 10 years ago. And there's a movement to address depression and anxiety in people living with MS because we know it affects one's ability to stay motivated and healthful. And it's also a problem in care partners. So again, really important to know these symptoms, to discuss them with one another, and to point them out if they're happening and get help if that's the case. So what do you do as a care partner if you think you're starting to experience these things? Well, you don't withdraw. You do what you probably least want to do, and that's ask for help. You be clear about your needs. You have a backup plan for care, and you communicate with one another and with your village. So this is where a village comes in really handy. If, for example, you have a deadline at work, you're working a 60-hour week, and it happens to be the week that your husband or wife has an appointment with the neurologist, the urologist, and 3 physical therapy appointments. You cannot take off work. That's when you start to call your village and say, hey, we need help with transportation on these days for these hours. And you call a different person who's a resource for maybe for food and say, hey, can we set up a food train for our family for Tuesday, Wednesday, and Thursday of this week for dinner. And there are actually websites that you can do, that you can set up this sort of thing on. I've seen them used mainly for women coming home from the hospital after having babies, and also for people who, say, live alone and have had surgery. And I certainly think that they'd be effective in these situations as well. And then having a backup plan for care gives you the ability to, and I'll go back a couple of slides here, but it gives you the ability to stay in bed when you're sick, or to have a rest if you need to. So self-care for the care partner means taking regular time outs instead of getting sent to them. I think that's a great piece of advice. Connecting with other care partners. In Jacksonville Beach, Florida, where I live, we teach yoga to people living with MS, and we're almost 7 years in. And at one of our classes, the one that I teach, a couple of the husbands, after they drop off their wives, they go get dinner and they hang out together while we're all at yoga, and that's a really great source of comfort and friendship for them. You make time for exercise, recreational activities, fresh air. You eat healthfully. You develop a plan for stress management. You keep your own, I would say, schedule and keep your own medical appointments. You learn proper body mechanics if you are involved in physical care. You practice positive self-talk for yourself and also for your loved one. And then you identify what you can and can't change. Because frankly, in any situation, there are things that you cannot change. And the sooner that you accept those things, the more likely you are to be able to move forward. So these quotes here are from a very dear friend of mine whose wife lives with MS, and she has fatigue that sometimes keeps her home from work. She has some depression that is sometimes exacerbated by her fatigue, but she's still in the workforce full-time. She works a very demanding job. And this would be a situation that I would call invisible care partnering. So I asked him some very specific questions, and he gave me some very specific answers. He said he's constantly concerned that things could be worse and that there's nothing he can do about it because he's a man and he wants to fix things. He worries that if MS gets worse, are we still in a place financially that we'd be able to live a, quote, normal life? He worries about something happening to him. So will she be okay if something happens to me? And to his credit, he practices self-care, and she encourages him to do so because she wants him to be the best that he can be for their family, not just for her. He says that he doesn't want her to see him get worried. He tries very hard to be a positive influence, and he tries not to get frustrated, but he does when she's fatigued because he doesn't understand it. And I don't think until you live in that body that you really can. But he does say what's going to happen is going to happen, and no amount of worrying is going to change it. So he thinks that sometimes he's painfully optimistic. He prefers to be proactive rather than to spend his time worrying about it, and he likes to think of a positive outcome. He also supports her in any healthy habit change that she wants to make. He supports her in all of her efforts to raise money for the MS community. And I know that their communication helps significantly with their relationship with multiple sclerosis. Now, communication is key, and that care partnership is a two-way street. So effective communication needs to be frequent because MS is unpredictable. It can't be like, oh, we're going to have a conversation about this once a year. It just can't be like that because once a week you may be down and out. You may be down and out more often than that. So you need to communicate about your needs when you have good days and your needs when you have bad days, both when you're the person living with MS and when you're the care partner. From the standpoint of respect, you should speak in specifics, in I statements, and without blame. So I feel angry, not you make me feel angry. You should speak without sarcasm or sarcastic body language. You should listen so that you can confirm what you heard. You should listen without interruption, and you should listen without judgment. And I think the most important warning is that problems that were previously present in a relationship will get magnified when MS comes into the relationship. So if you had issues in your marriage or in your romantic relationship or in your friendship or in your family relationship that were deep-rooted before multiple sclerosis came on board, you really need to address them with a mental health professional as soon as possible, whether that be individually or couples therapy, but they're not going to get better. They're just going to get, that stew is going to get full of more ingredients. It's going to get spicier and hotter and harder to swallow. So oftentimes I will recommend individual or couples therapy to people, or family therapy to people who are in care partner relationships. Communication resources include being clear about your needs, discussing advance directives and will on a regular basis. And, I find that people sometimes cringe when I bring up advance directives and a will. But frankly, if you are my age, which is pretty old at this point, but if you have any dependents or any assets with or without MS and you don't have an advance directive or a will, then you really need to get on board with that just adult responsibility of taking care of your loved ones. And if your health situation changes, then it's important to change that advance directive or make sure that it's still working for you. You should make a list of alternative helpers together. So, someone who the care partner is comfortable with might not be someone who the person living with MS is comfortable with, and you want to make sure that you're collaborating on those responsibilities. FMLA papers are the paperwork that's supported by the Family Medical Leave Act, and these papers can be filled out for the person living with MS if they're still working, and also for the support partner who may need to be out of work to care for the person living with MS. And you really should get those filled out before you need them. And I say that because the worst case scenarios in my almost 20-year career of doing this have been for the people who are having, you know, their first relapse in many years and need to be off work and are struggling to, you know, do the things that they absolutely have to do during the day, and then they have to call human resources and get the paperwork filled out so that they don't get docked time for being out of work for their relapse, and then they need help with transportation, and then the support partner needs the paperwork filled out, and they all need it within 72 hours, and the doctor's office says we need a week to fill out forms. So you get my drift. I encourage people to actually get these filled out on a regular basis at the time of their diagnosis, because having them, again, part of the village before you need them is better than having to worry about it when you need them. Make timeouts for health and respite for both of you. There was a question asking about things that you can do together to build a relationship, and the scope of the objectives of this talk were really to provide resources for the care partner rather than to talk about the relationship between the care partner and the person living with MS. But I think some of the things that you can do together would be things that you used to enjoy doing together and you still enjoy together, and making a concentrated effort to schedule those things, just like you would in any other busy relationship. Like, this relationship just got busier because of multiple sclerosis. So if you enjoy doing an outdoor activity together, if you enjoy cooking together, if you enjoy going to certain types of restaurants together or seeing movies together, if you're both motivated to make a healthful lifestyle change, then you can motivate one another, certainly. I would say that those are things that should enter this conversation about communication resources. And then even listing out problems and solutions in detail. So let's say you worry about, what happens if I have to go from using a cane to a walker and I'm afraid to get up in the middle of the night to use the bathroom. So you have that conversation with your support partner and you list out solutions for that you're both comfortable with. Or what happens if, I'm having significant issues with my vision and there's an emergency in the house. How do I know that I'll be okay and the children will be okay if you're not home? Really, it's almost like I remember in grade school the exit plans for the fire drills. It's almost like that, and if having those written out is helpful for you, then by all means do it. And then again, considering counseling. And sometimes counseling is helpful for both individuals and then as a couple. And counseling might include talk therapy. It might include even sex therapy if this is a romantic relationship and roles have changed, such that the person who is a care partner is performing more hands-on, task-oriented care related to hygiene or toileting. Oftentimes that takes away the romanticism, or at least in someone's mind, right? It takes away the romanticism of the intimate relationship. So that's something that's also available. Resources for care partners are many. The large multiple sclerosis nonprofit organizations like this, the MS Association of America, the MS Foundation, the National MS Society, have excellent resources for care partners. I would encourage you to take a look at the webinars that MSAA and Can Do MS have done for care partners, and specifically for enhancing the relationship aspect of the care partnership between the person living with MS and the care partner, because they both have excellent resources for that. The National MS Society has MS navigators, and these are people who are specifically trained to help you navigate a system in case you need home health aides or respite care or help with transportation. The Veterans Administration has excellent resources for care partners. If you are a veteran, I believe you are eligible for up to 30 days per year of respite care, which can be helpful certainly for a care partner, but that's a decision that would have to be made together, kind of a quote timeout or time off for the care partner. The Family Caregivers Alliance is a website that I found had extremely good information. The Caregiver Action Network, elder care, even though people living with MS are not all of older age. Unfortunately, most of our resources come from people who have been caring for people with dementia for years. And then the National Alliance for Caregiving. So in conclusion, I wanted to share some words that care partners use to describe the path of being a care partner, and those words are satisfying, an honor, and a privilege. So at the end of the day, even though we're talking about a role that is often hard and can certainly result in health challenges for the care partner, that if you truly do put on your oxygen mask first, you can avoid that downward spiral of burnout and health issues, and truly work on a very satisfying mutual relationship of caring for one another. And with that, I'll end with the Serenity Prayer, which basically says that acceptance is key, and that having courage to change the things you can and wisdom to know that some of them you can't change certainly results in an easier path than continuing to try to blow down locked doors, so to speak. So Peter, I'll turn it over to you at this point for questions.
Great. Megan, thank you so much for such an informative presentation. Covered a lot of ground, a lot of helpful information, and some great examples and insights. So thank you so much.
Sure thing.
And great job incorporating some of the questions that we did get through the program into your presentation. There's a few more that came in, so I want to get to those. One person asked, how can a caregiver and an MS person work with each other to avoid the short fuses that may come up from time to time, especially dealing with, work, small children, just life in general?
So, the best answer I can give you for that is to sit down with your care partner and make a list of the things that cause you to have short fuses. And it may even result in, some amusing conversation and anecdotes. I mean, I'm just thinking about myself and work and small children and things that happen that you don't expect. And, making a list of the unknowns, of your worries, of your concerns, and then really just mapping out solutions for those problems can help with the short fuses. And if you both are egging each other on, because as most of us know with our loved ones, we all know how to press their buttons, then, you know, that might really be the time to look for some professional counseling to learn how to have discussions with one another. My take on counseling is that if you wait until there's a marital problem to attend counseling, it's too late. You know, it's kind of like exercising in a different way. It's exercising your conversational skills, and we all need help with exercise. We all need help with language and the way we speak to each other. Even though it might communicate the correct topic, doesn't always communicate the correct emotion. And so working with a professional to do that might be the answer for the short fuses if you can't work through them together.
Great response. And kind of on that same note, you mentioned the example of the gentleman with the quotes, and he was frustrated because he wants to fix things. And you mentioned, I guess that's a tendency that men in that relationship have. And how can that communication then work between men and women if they have different concepts of working through this?
Absolutely, yes. So I made a very sexist comment. I'll apologize for that right off the bat. I probably offended some people, and I'm sorry about that.
No, not at all.
So traditionally in the male gender role, the male gender wants to fix the situation. And, you know, the female tends to be more nurturing and caring, and this is I'm making huge generalizations here. The female role tends to be more caring and nurturing, and, you know, used to taking some time to amend the situation, whereas, you know, the male doesn't necessarily have that tendency. And again, I don't want to offend anyone by making comments about different gender roles, because we're all very different. But the basic component of making this better is communicating. So if you are, you know, a male caregiver, and you can just sense that when you come in to, you know, make things better for your for your care partner, or you need to change a situation about something, or you need to help, and you can sense that the person you're caring for isn't quite responding to your approach, you know, you really shouldn't sweep that under the rug. It's better to just say, you know, I can sense that you're not comfortable with the way I'm handling this situation. And the opposite is true. So again, this is just about communication. And let me tell you something, folks. It is difficult to be honest and communicate honestly. It is difficult to be open and honest. But we can't live together unless we're open and honest. So
yeah,
sometimes
absolutely.
you just have to take a deep breath and swallow and say, I sense what I'm doing is not the right way for you. Can you help me? Because I want to create a good situation for both of us.
Right. Yeah.
And the first time it's hard, the second time it gets easier.
Right. And what about someone who wants to have their care partner take a break, but that person doesn't feel they need a break? And you mentioned about, you know, the importance of self-care, and I love the example of putting the oxygen mask on first. So how does that communication work?
So that's when the person living with MS takes on the role of being the care partner. That's when the role switches, really. And if having a conversation like, you know, honey, I'm worried about you. I'm concerned about your health. I want you around for a long time. Not just I need you around, but I want you around for a long time. I love you, and I appreciate our relationship and all of its aspects. And I really think that you deserve a break. If that conversation doesn't work, then I would recommend that you maybe enlist the help of a friend or a family member to take the care partner aside and say, "Hey, man, you know, you do a lot of work, and we can help. And maybe you need to take a couple of days off."
Yeah, absolutely, and get them to get that much needed care and a break for sure.
Yep.
Another question came in. This is a little tricky. How can you handle convincing someone with MS that they might have some mental or cognitive issues? In one particular case, imagining things that aren't just real.
You know, I would definitely recommend making an appointment with either the neurologist or the primary care provider and enlisting help with that in that situation. And if the person is very resistant to that and has gone to the healthcare provider and not reported this information because clearly they don't think it's a problem, one of the things that I've been on the receiving end of many times are letters from care partners or family members about specific behavior that they're worried about. Because of the Health Information and Portability Act, unless a person is listed as, an emergency contact or an approved contact, a healthcare provider can't necessarily engage in meaningful two-way conversation, but they can certainly receive the information. So if you wanted to, write a letter and drop it off or fax it to the physician office, and the physician office may say, I didn't know this was happening. Maybe we need to give Mrs. Smith a call and schedule an appointment for her and see if we can get to the bottom of the issue. Believe it or not, there's some detective work, kind of like secret agent stuff that can go into taking care of people. It happens more than you know. So that's what I would advise if the person is resistant to your attempts to ask them to seek help.
Okay, great. Thank you for that. And I guess just generally, you mentioned a lot of different resources, and someone asked to see the slide again, and appreciate mentioning our organization and the website and the other content we have. We have a helpline that people can call and ask our client service team about resources and information as well. And these all seem like excellent resources for people, and I just wanted to bring that slide up there as well.
I do see the question also about the Veterans Administration. If you are a veteran, because this is really an invaluable service, if you go to just www.va.gov and search Multiple Sclerosis Centers of Excellence, there's actually a drop-down for caregivers and partners. And when you click on that drop-down, there's a page, and on that page, there's a link for respite care. So you can click on that link, and then there's a process for figuring out if you're eligible to receive respite care. And then there are also some other helpful resources that anyone can access. You don't have to be a veteran to access, some of the other print resources.
Great. That's excellent advice. Thank you so much. Well, actually, we're running up against our time limit, so I want to thank everybody for attending tonight's webinar, The Partnership of Care, Redefining Caregiver to Care Partner. I especially want to thank our guest presenter, Megan Weigel, for her excellent presentation on this very, very important topic, as well as our funding supporter, EMD Serono, who assisted with tonight's webinar, as well as additional resources on care partnering, including our Ask Me Anything that is coming up next Monday, March 25th, from 6 to 7 p.m. Eastern Time, and that information is on our website, so we encourage people to, again, continue this conversation about care partners and MS and really get some valuable insights and resources. As I mentioned, tonight's webinar will be archived on our website, and we will work very hard to get that up within the next couple of days. And at the very end of this presentation, there is a brief survey that I encourage people to take a few seconds of their time and complete and give us feedback about this program and other topics that you might want to see MSAA cover in the future. So once again, thank everybody. I want to thank everybody for listening. I want to thank Megan for her great information and insights, and I wish everybody a wonderful night. Thank you so much.
Thanks, Peter. Thanks, everybody.